Hi, my name is Tyler Stewart, and I am here to do my head to toe assessment today. My patient is here. She chose to wear comfortable clothing as opposed to a gown. She, um, we had her empty her bladder prior to examination. We took her vital signs. They were normal. Took her height and weight. They were normal for her age. Her BMI was normal. We checked her gait. Her gait was steady. And we also tested her distant vision with the Snellen chart and her near vision with the Rosenbaum chart. Okay. First, I'm going to take a look at her skin. Her skin is uniform, no visible lesions or lumps present. I'm going to palpate her skull. Her skull is normal cephalic, it's symmetric. Her scalp moves along her skull without any difficulties. Her hair is evenly distributed and it is soft. And I'm going to palpate her facial bones. They are um, without any deformities or lumps or masses. I'm going to palpate her frontal sinuses, her maxillary sinuses, her lateral aphthous. I'm going to palpate her temporal mandibular joint. Can you open and close your mouth for me? Okay. And there is no pain felt. There are no crepitus, clicks, or pulsations present. I am going to take a look at her eyes. Her eyebrows are symmetric. Her eyelashes curve outwards. I'm going to take a look at her conjunctiva. Can you look up for me? Okay, her conjunctiva are pink, moist. Her sclera are white. Um, I'm going to test her facial sensations. Can you close your eyes for me and tell me if you feel soft or sharp? Okay. And then next, I'm going to test her facial um, cranial nerve. I'm going to have you make some facial expressions. Can you smile? Can you puff out your cheeks? Can you clench your jaws together? Can you squint your eyes? Can you wrinkle your forehead? And um, can you stick your tongue out? Okay, you close it now. All right. And next, I am going to take a look at her pupil responses. I'm going to have to shine a light in your eye and have you look at the object straight forward. Okay. And I'm going to check her consensual response, direct, consensual, direct. Next, I'm going to check her 6 cardinal fields of gaze. I'm going to have you look at my pen light and follow it. Okay. And next, I'm going to have her do the cover uncover test. I'm going to have you cover one of your eyes, look straight ahead, and uncover, and cover the other eye, uncover, and do it one more time for me. Cover, uncover, and cover, and uncover. Her eyes are without any extraocular movement. Um, and next, I am going to have her. I'm going to check her hearing. First, I'm going to look at um, the alignment of her ears. The tops of her ears are aligned with her eyes, and the outside of her ears, they do not show any masses or nodules. They are uniform with her skin. I'm going to palpate her auricles for any nodules. There's no pain or tenderness felt. Now I'm going to take a look at her ear canal and her tympanic membrane. I'm going to have you turn your head. Okay, and I can see a pearly gray tympanic membrane. There is a moderate amount of cerumen in the ear canal. Next, I am going to do a few hearing tests on you. I'm going to come behind you. Can you cover one ear for me? And I'm going to whisper a word, and can you, or whatever, whisper something, and can you repeat it for me?
1, 2, 3.
Okay, can you cover the other side?
4, 5, 6.
Okay. Next, I am going to test her hearing with the Weber test. I'm going to strike the tuning fork, and I am going to place the base of the tuning fork on the top of her head, and she will tell me if she if she hears the sound equally in both ears. Okay. And next, I'm going to do the Renee test, where I'll test bone conduction versus air conduction. I'm going to place the base of the tuning fork on the back of on your mastoid bone, and then you'll tell me when you don't hear the sound anymore, and then I'll place it in front of your ear canal, and you tell me when you don't hear it anymore. Okay, I'm going to do the other side. Okay, and her air conduction is greater than her bone conduction, so that is normal. And next we're going to move on to her nose. So her nose is midline, it is symmetric on each side, without any palpable masses, no lesions. I am going to take a look at her uh, septum. I'm going to take a look at her turbinates and her nasal mucosa. Tilt your head back a little bit. Her turbinates, nasal mucosa, and septum are all pink, slightly moist without any inflammation present. I'm going to test the patency of her nares. I'm going to have you close one side. Can you inhale and exhale? Okay, and do the same with the other side. Okay, her nostrils are patent. I'm going to take a look at her mouth now. Her lips are moist and they are pink. And then I'm going to take a look at her buccal mucosa, her gums, her hard and soft palate, and the floor of her mouth. Can I have you open your mouth? Okay, and raise your tongue. Okay, they are all pink and moist. And I'm also going to take a look at her uvula, her tonsils, her anterior and posterior pillars, and her posterior pharynx. Okay, I have you say ah, and her uvula and soft palate rises and falls together. Can you say cheese really big? Her gums are without any inflammation. They are moist, and she has 32 pearly white teeth without any deformities. Um, can you stick your tongue out for me? Move it up and down. And then can you um, push your tongue against my hands? Okay. And then And then let me check. Um, let me see. Let me check for your gag reflex. Good. And there we go. That's fine. And we're gonna take a look at your throat. Nope, no, your throat. Good. I'm gonna look at your neck. I'm sorry. Her trachea is midline. Her um, her thyroid is not present. Well, it's not visible. Her trachea feels like it's midline. I'm gonna check her carotid pulses. Okay, and I am going to have you swallow so that I can feel your thyroid move up and down as you swallow. Okay, and next I'm going to palpate her lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, deep cervical, posterior cervical, supraclavicular, infraclavicular, and then axillary. And all her nodes were not passable. There was no jugular venous distension present. Uh, can you move your neck from side to side for me? Okay. And can you push against my hand? Push. Okay. Her neck range of motion is intact. And can you, let me listen for your carotids. I'm going to listen for her carotids one at a time. Ensure that there are no bruits present. And I'm going to listen over her thyroid, make sure there's no bruits present. Next, I am going to test her shoulders and have you move them up and down. Okay. And next, I'm going to take a look at your arms. Can you take your arms out for me? Her shoulders, arms, and hands are all symmetric. They are the same length. Her skin is warm, dry, no edema present. I'm going to check her brachial pulses, her radial pulses. And then take a look at her nail beds. They are without any splitting, any clubbing, any cyanosis, and her capillary refills are less than 3. Her arms are normal. I am going to have her turn around. I am going to inspect her back, look at her skin, make sure that it's uniform, there are no visible masses or lesions present. I am going to palpate her back. Can you say 99? 99. Okay, and that is testing for the tactile primitus. There's vibrations felt throughout her lung field. Next, I'm going to test for her lung expansion. Can you take a deep breath? Okay. And with her deep breath, my my thumbs move outward, showing that her lungs are expanding evenly on both sides. Next, I am going to percuss and palpate her costal vertebral angle. That is making sure just making sure there's no pain or tenderness felt. I am going to percuss throughout her lung field. And I'm going to go laterally. Okay. Next, I'm going to check for diaphragmatic excursion. I am going to have you take a big deep breath and hold it. Okay, and stillness has been heard. Let it go. And take another deep breath and let it out. And now hold it. I'm gonna go back up to where resonance is heard. And marking those two spaces, there is 3 to 5 centimeters in between that area. And now I am going to auscultate her lung sounds. Deep breath. Deep breath. Deep breath. Check her lateral side. Okay. And I'm going to take one more look at her back. Her anterior, posterior to lateral is 2 to 1 ratio. And I'm going to have you turn back around. And I'm going to take a look at her chest. Her respirations anteriorly and posteriorly are even, unlabored, without the use of any accessory muscles. Her skin is uniform with the rest of her body. There are no palpitations or heaves present by looking at her chest, and her chest rises and falls evenly on inspiration and expiration. I am going to first palpate your chest. When I touch you, can you say 99?
99, 99, 99, 99, 99.
Okay, and vibrations are felt throughout her lung field. Next, I am going to palpate for those pulsations and heaves across her pericardium. None are felt. I am going to percuss her lung fields anteriorly. Okay, and resonance is heard throughout her lung fields. And next, I am going to auscultate her lung sounds. When you feel my stethoscope, just take a deep breath. Lung sounds are clear without any crackles, wheezes, or rhonchi present. Next, I'm going to take a listen to her heart. I am going to listen for her arteries of the heart. First the aorta, then the pulmonic, then the Erb's point, her tricuspid valve, her mitral valve. I'm going to palpate for her apical pulse. Okay, all of her heart sounds were even, within a normal range, and the S1, S2 sounds can be heard, and there were no murmurs. And I think we're good with the heart. And next we are going to move on to your abdomen. And I'm going to move these things out of the way and have you lay on your back. Raise your shirt. First, looking at the contour of her abdomen, looking at it's symmetric. Her umbilicus is midline. There are no visible movements or pulsations present in her abdomen. Um, Next, I am going to auscultate over her entire abdomen. All of her vowel sounds are present. And next, I am going to listen for the arteries located in her abdomen. I'm going to listen to the aorta, the renal, the iliac, and the femoral. Oops, sorry. No abnormalities there. And next, I am going to percuss the abdomen. I'm going to percuss, listening for tympany throughout and dullness over the areas of the organ. I am going to percuss for the borders of the liver and spleen. And then can you turn on your side for me? And test for splenic dullness. Okay, dullness is heard, and you turn back on your back. Okay, now I'm going to do light palpation of the abdomen. There are no pains felt, no abnormalities. Next, I'm going to do deeper palpation. I'm going to check the left costal margin for the liver, the right costal margin for the liver, and left for the spleen. Okay, I'm going to feel for the aortic pulsations. Okay, and that is present. I am going to check for her kidneys posteriorly. Okay, and when I have her sit up, I am going to look at the tone and symmetry of her abdominal muscles. So can you slowly sit up for me? Okay, and her abdominal muscles are aligned in tone. Okay, can you swing your legs forward for me? All right. Next, I am going to take a look at her lower extremities. Um, Her legs are warm to touch, no coolness felt, no edema present in her lower extremities. Um, the skin is without any lesions. The color is uniform and the hair is evenly distributed. I am going to check for her pulses of her legs and feet. I'm going to check your popliteal pulses. Relax your legs. Your dorsal pedis pulses. And your posterior tibial pulses. Okay, and they all are 2 plus, um, equal rate and rhythm. Uh, Next, I am going to check for your reflexes. I'm going to start with your brachial. And then the Kiwis. And all of her reflexes are present. I am going to test her range of motion and strength. I'm going to have her pull against my resistance. Okay, now push. Okay, pull. Okay, and push. Okay, good. She has good strength, good range of motion. I am going to have her stand, and I'm going to check her range of motion of her upper body. Can you twist from side to side? Okay. And can you lean side to side? Okay. And her range of motion is good. I'm going to take a look at her cervical, thoracic, and lumbar spine, which is aligned, which is um, even. I am going to have her bend forward, looking for any scoliosis, any curvatures of her spine, any kyphosis, none present. Okay, and you can stand for me. And now we will go over, when you have a seat, we're going to go over the cranial nerves that we went through throughout the presentation. So the first cranial nerve is the olfactory, which we were not able to do due to not having the tools, but it tests the smell. Cranial nerve 2 is the optic nerve, which was used for the used with the Snellen and Rosenbaum charts. Optic nerves 3, 4, and 5. Those are the ocular motor, trochlear, and abducens, which were tested with the 6 cardinal fields of gaze. Then we have cranial nerve 5, which is the trigeminal nerve, which tests the facial sensations that we went through. Then we have cranial nerve 7, which was also the facial, but that was the facial movements or expressions that we did. Then we have cranial nerve 8, that is the acoustic, which is with the Weber test. Um, Next, we have cranial nerve 9 and 10, which are the glossopharyngeal and the vagus, which was tested using the ah, the gag, and the swallowing. Next, we have cranial nerve 11, which is the spinal accessory, which was tested using the shoulder shrug. And cranial nerve 12 is the hypoglossal, which was tested using the tongue movements. And that concludes my presentation. Thank you.